My name is Margot Wrigley and I work as a psychiatrist in the HSE. My current role is as National Clinical Lead for the Adult ADHD Clinical Programme. You're about to hear from Shifra, who was diagnosed as having ADHD in young adulthood.
So I was only diagnosed 3 years ago with ADHD when I was 23, which I know sounds a bit strange because everyone thinks of ADHD as being a kid's problem. I found national school really easy. I was good at arithmetic and at English, and I was very articulate as well. But I seemed to go downhill when I was around 11. I lost interest in school. I couldn't concentrate and I suffered a lot from depression. Moving classroom for each subject was a nightmare in secondary school. I never had the right books with me. I wasn't even in the right room sometimes. I just couldn't focus and my head seemed to be buzzing with pointless thoughts all the time. By the time I was 16, I was just barely going to classes at all. I didn't seem to be any point. But I did do the Leaving Cert and I got 190 points, not too surprising, but some of my classmates went on to study actuary and law and medicine. I did a few jobs, mostly in retail. I was interested in physical fitness, so I tried to start a business in that. While I enjoyed the teaching side, I just couldn't organise the business part of it at all. You know, the bookings, the money, taxes. So 5 years after I left school, I just hit rock bottom. I felt very depressed and hopeless. I couldn't see a future for myself. And that was just before Christmas, so my family were really worried about me. A family friend saw me casually and she put me in touch with the psychologist. The psychologist diagnosed me as having ADHD and also said that I had a high IQ. It was a relief to know I had a definite diagnosis, that it wasn't just me. You know, I was surprised too because I thought that only children had ADHD. And I was encouraged to hear that I had a high IQ, as it gave me some hope that, you know, things could be better if the ADHD could be treated. The psychologist told me about, you know, the sorts of treatments available for ADHD, and I did a lot of research too. It seemed that medication and learning how to manage symptoms such as poor attention and developing better organisation skills was the best combination. I found out you need to see a psychiatrist to be prescribed medication for ADHD, so I went to my GP, who referred me to the local HSE mental health service, but they refused to see me. They said they just didn't see people with ADHD, so I felt, yeah, really disappointed and angry, but I'm lucky that my parents could pay for me to see a psychiatrist privately. I hit another wall. There was no private psychiatrist in Ireland seeing people with ADHD. She just said they didn't deal with ADHD, and the one who did had to close the waiting list because it was so long. I felt quite desperate, you know, just completely helpless and trapped, but luckily the same friend who linked me in with the psychologist knew of a psychiatrist in Belfast who did see adults with ADHD. I got an appointment, which was relief, but I did worry about the cost to my parents, and then travelling up and down to Belfast was stressful. That psychiatrist confirmed I had ADHD and started me on medication. He reviewed me until I was on the right dose for me, so that took a few visits. It's given me a platform, and from that platform I have been able to plan my life. I've also worked with an ADHD coach and had career guidance to help me decide what my goals in life are and how to work to achieve them. I decided I wanted to do medicine, and that meant getting into college through an access course. It was very hard at times, and I did feel like giving up, but I had the professional support to help me with just about everything, sending in applications to college, study skills, organisational skills, and I made it. And now I'm studying medicine, and I'm feeling very happy with myself. But I know that I've been very lucky because my parents could afford to pay for all the help that I've had. The results I've got are due to what I would call a multifaceted approach. That's training, medication, and therapy. They've helped me to change my behaviours, to learn new skills, and to persevere, especially to persevere. Without all the help that I've had, I would be nowhere.
Thank you, Shifra, for giving us an account of your ADHD. There are 3 key take-home messages from Shifra's story. From the clinical perspective, I'd like to highlight that ADHD can be quite commonly diagnosed in adulthood. This is especially true of women who may have been missed, as they're less likely to be hyperactive and impulsive compared to boys, but do appear to be rather dreamy in classrooms. ADHD can have a very profound effect on a person's ability to function and to have a fulfilling life, so diagnosis is key. ADHD-specific medication is very effective in most people, but it should be supplemented with interventions to improve organisational skills and to help manage emotions. My second message is that unfortunately there are extremely limited public ADHD services available for adults nationally. There are also no private psychiatrists currently accepting referrals from adults with possible ADHD. My final message is that the HSE now has a fully approved national clinical programme which would ensure the national availability of public services for adults with ADHD if implemented. Additional funding is required if it's to be implemented, but it would be very possible to put these services in place.